Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 9, Behavior Therapy. Introduction. Behavior therapy focuses on directly observable behavior, current determinants of behavior, and learning experiences. Anxiety disorders, depression, post-traumatic stress disorder, and so on have been treated. It is used in the fields of developmental disabilities, mental illness, education, community psychology, sports, medicine, and so on. 4 areas of development: classical or respondent conditioning. This refers to what happens prior to learning that creates a response through pairing. Operant conditioning focuses on a type of learning in which behaviors are influenced mainly by the consequences that follow them. Social learning, or social cognitive approach, gives prominence to the triadic reciprocal interaction between an individual's behavior, personal factors, and the environment. Cognitive behavior therapy. Social skills training, cognitive therapy, stress management, training, mindfulness, and acceptance-based practices all represent the cognitive behavioral tradition. Basic characteristics and assumptions. A set of clinical procedures relying on experimental findings of psychological research, based on principles of learning that are systematically applied. Focus is on the client's current problems and on assessing behavior through observation or self-monitoring. Largely action-oriented and educational. Therapist teaches clients skills of self-management. Behavior is something that can be operationally defined. It includes overt actions as well as internal processes. Change can take place without insight into underlying dynamics and the origins of a psychological problem. Behavior treatment interventions are individually tailored to specific problems experienced by the client. Behaviorists ask, what treatment, by whom is the most effective for this individual with that specific problem and under which set of circumstances? Therapeutic goals. The general goals of behavior therapy are to increase personal choice and to create new conditions for learning. Measure progress towards goals based on empirical validation. Goals must be clear, concrete, understood, and agreed on by the client and the counselor. Therapist's function and role. Behavior therapists conduct a thorough functional assessment, ABC model. Antecedents, influenced by events that precede it. Behaviors, model of behavior. Consequences, influenced by events that follow it. Client's experience and therapy. Therapist and client have the importance of client awareness and participation in the therapeutic process. Teaching concrete skills through the provision of instructions, modeling, and performance feedback. Clients are expected to do more than merely gather insights. They need to be willing to make changes. Relationship between therapist and client. Recognize the role of the therapeutic relationship and therapist behavior as critical factors. Experimental therapy's emphasis on the nature of the engagement between counselor and client. It helps the clients change in the direction they wish. Applied behavioral analysis, operant conditioning techniques. Positive and negative reinforcement. Goal, to increase target behavior. Extinction, goal, to decrease or eliminate a behavior by withholding reinforcement from a previously reinforced response. Positive and negative punishment, goal, to decrease target behavior. Progressive muscle relaxation. Progressive muscle relaxation is a popular method of teaching people to cope with the stresses produced by daily living. Relaxation becomes a well-learned response, which can become a habitual pattern if practiced daily. Relaxation procedures have been applied to a variety of clinical problems, ranging from chronic pain to panic disorder. Systematic desensitization. Based on classical conditioning, systematic desensitization, SD, was developed by Joseph Wolpe. SD is effective and efficient in reducing maladaptive anxiety and treating anxiety-related disorders, particularly phobias. SD entails relaxation training, development of a graduated anxiety hierarchy, and presentation of hierarchy items while client is deeply relaxed. In vivo exposure and flooding. In vivo desensitization involves client exposure to the actual anxiety-evoking events rather than simply imagining these situations. Flooding. In vivo or imaginal exposure to anxiety-evoking stimuli for a prolonged period of time without the feared consequences. Eye movement desensitization and reprocessing, or EMDR. An exposure-based therapy involves imaginal flooding, cognitive restructuring, and the use of rhythmic eye movements and other bilateral stimulation to treat traumatic stress disorders. Extensive research has validated EMDR. EMDR compresses three-pronged methodology to identify and process memories of past adverse life experiences that underlie present problems, current situations that elicit disturbance, and needed skills that will provide positive memory templates to guide the client's future behavior. Social skills training helps clients develop and achieve skills and interpersonal competence. May involve behavioral techniques such as psychoeducation, modeling, behavior rehearsal, and feedback. If clients can correct their problematic behaviors in practice situations, they can then apply these new skills in daily life. Self-management programs and self-directed behavior. In SM programs, people make decisions concerning specific behaviors they want to control or change. The process includes selecting goals, translating goals into target behaviors, self-monitoring, working out a plan for change, and evaluating an action plan. SM strategies have been successfully applied to many populations and problems. Multimodal therapy, clinical behavior therapy, a comprehensive, systematic, holistic approach to behavior therapy developed by Arnold Lazarus, grounded in social cognitive learning theory, applies diverse behavioral techniques to a wide range of problems that encourages technical eclecticism. Mindfulness and acceptance-based approaches emphasize limits for behavioral therapists include mindfulness, acceptance, the therapeutic relationship, spirituality, and values. The 5 interrelated core themes are psychological health, acceptable outcomes in therapy, acceptance, mindfulness, creating a life worth living. Mindfulness is the awareness that emerges through having attention on purpose in the present moment. Acceptance is a process involving receiving one's present experience without judgment or preference. 4 major approaches: dialectical behavior therapy, mindfulness-based stress reduction, mindfulness-based cognitive therapy, acceptance and commitment therapy. Multimodal therapy, basic ID. The complex personality of human beings can be divided into 7 major areas of functioning. B is behavior, A is affective responses, S is sensations, I is images, C is cognitions. I is interpersonal relationships. D is drugs, biology functions, nutrition, and exercise. Dialectical behavior therapy, a promising blend of behavioral and psychoanalytic techniques for treating borderline personality disorders and other issues. Includes both acceptance-oriented and change-oriented strategies. Skills are taught in 4 modules: mindfulness, interpersonal effectiveness, emotional regulation, and distress tolerance. Mindfulness-Based Stress Reduction, MBSR. MBSR is not a form of psychotherapy per se, but it can be an adjunct to therapy. MBSR assists people in learning to live more fully in the present. The skills taught in MBSR include sitting meditation and mindful yoga aimed at cultivating mindfulness. MBSR programs are offered in hospitals, clinics, schools, workplaces, offices, law schools, prisons, and health centers. Mindfulness-Based Cognitive Therapy, MBCT, an 8-week group treatment program of 2-hour weekly sessions adapted from MBSR that includes components of cognitive behavior therapy, CBT. Clients learn to respond in skillful and intentional ways to their automatic negative thought patterns. Kindness and self-compassion are essential components of MBCT. Acceptance and Commitment Therapy, ACT. ACT involves fully accepting present experience and mindfully letting go of obstacles. There is little emphasis on changing the content of a client's thoughts. Instead, the emphasis is on acceptance, non-judgmental awareness of cognitions. ACT uses acceptance and mindfulness strategy to increase psychological flexibility. Application to group counseling. Rely on empirical support and tend to be brief. Emphasize self-management skills and thought restructuring. The specific unique characteristics include the following: conducting a behavioral assessment, spelling out collaborative treatment goals, formulating specific procedure appropriate to a particular problem, evaluating the outcomes of therapy. The 4 approaches applied to the practice of behavioral groups are social skills training groups, psychoeducational groups with specific themes, stress management groups, mindfulness and acceptance-based behavior therapy in groups. Strengths from a diversity perspective. Behavior therapy may appeal to culturally diverse clients for many reasons. Behavior therapy emphasizes on brief interventions, teaching coping strategies, and problem-solving orientation. Behavior therapy focuses on environmental, social, and political conditions that contribute to a client's problems. Shortcomings from a diversity perspective. Some counselors may use a variety of techniques in narrowly treating specific behavioral problems. Therapists who do not assess the interpersonal and cultural dimensions of the client's problem may not adequately prepare him or her for the consequences of newly acquired social skills. Contributions of behavior therapy. The specificity of the behavioral approaches helps clients translate unclear goals into concrete plans of action. A wide variety of specific behavioral techniques have been developed. Behavioral interventions have been subjected to more rigorous evaluation than other approaches. Behavior therapy emphasizes ethical accountability. Limitations and criticisms of behavior therapy. Heavy focus on behavioral change may detract from clients' experience of emotions. Some counselors believe the therapist's role as a teacher de-emphasizes the important relational factors in the client-therapist relationship. Behavior therapy does not provide insight. Behavior therapists emphasize changing current environmental circumstances to change behavior. Behavior therapy recognizes the importance of making the social influence process explicit, and it emphasizes client-oriented behavioral goals. Therapy progress is continually assessed and treatment is modified to ensure the client's goals are met.